Perfect Derma
I'm
feel?
ready.
All right, here we go. So easy, no preconditioning, very little pain for a few seconds, if any, and in 7 days you'll have beautiful, refreshed skin with less wrinkles and less pores and more of an even skin tone and a glow. How you feeling so far?
It's fine.
Do you feel any uncomfortableness?
I feel a little tingling in my forehead, but it's totally tolerable. It's barely even worth mentioning.
Okay, great. If you want to use the fan, you can. It's not a problem.
Now
If
it's
you need
heating
it.
up. It got hotter.
It did? Okay.
Now it's worth mentioning, but it's still tolerable.
So this is probably, that first pass is the worst pass. After that, you shouldn't feel anything. So we marinate and massage it into the skin. And then if you would like, sometimes you could put a little Vaseline on your lips and a little in the corners as a little buffer. Do you have a little aqua? No, you don't need to there. Okay. Just in the lips. Do you have a little aqua for here?
It's in the other room.
Oh, all right. All right, that's first pass. You should get 5 to 7 passes.
Okay.
The more passes, the better the peel. You want to marinate, saturate, and agitate it in. So now, I'm doing it with a nice firm pressure. I'm gonna do, I don't go under and over the eyes to the 3rd or 4th pass. Why? I want the patient to acclimate and to know what to expect. So by going under and over the eye in the 3rd, 4th pass, they're very relaxed. They now know this doesn't sting, and they're fine with it. Because those areas are thinner skin, they can be a little more sensitive. How you doing there, Lauren?
Good. Warm. I definitely feel a warm sensation, but...
Do you want to put the fan on? With the fan, you'll feel nothing, just to feel the difference?
I'm okay without it.
Really?
Yeah.
Okay. You're definitely going to need it when I go under your eyes.
Okay.
That I recommend. Okay, so I'm going to dip again, and I drain it. Usually people have more hyperpigmentation on their left side because of driving. And Lauren has very good skin and it's good condition, but there's a little bit of hyperpigmentation, sunspots from the sun on her left. That we are going to try to eliminate. Do you feel any warmth or? Yeah, put the fan. Don't put the fan. Fan, you won't feel anything. With the fan, you won't even know I'm here.
I think there's a higher skin.
You can go closer if you'd like.
It does feel better.
Yep. No big deal if your client wants a fan. We just want them to be comfortable and I do nice long strokes. I never dip and go straight to the neck because the neck's more sensitive because it's not exposed to the sun like the rest of the face and neck. How you doing? Good now with the fan?
Oh yeah.
Okay, you want a little tissue? It's your eye.
Comfortable.
Really?
Yeah.
Oh, got one spot up here. See how I'm running the spot, Christine? You want to open your eye for 1 minute? We're just gonna. With the fan, it's like nothing, right? All right. And you want to fold your lip in like this? There we go. I go slow above the lip because I don't want to get the lip out. Okay, now we're going to go under and over the eye, and I'm going to let you do it. And then I dip, and then I'm going to use a little over here. Usually I do the left side, but I already did the left side. with my free feet. Look up. Head down a little more. Look up and just relax. 1, 2, 3. Okay, fan. Count to 15 seconds and it will go away. So I say 15, 14, 13, 12,
This is your
11.
This burns.
Yes. This will. This is the most sensitive area. And if I count from 15 down, by the time it gets to 0, they're like, it's gone. So you do 5 to 7 passes. As many. I don't even count. I just keep going. Yeah, exactly. But the more passes, the better. How you doing now? It's gone. Okay, good. Now I can move over here if that's better for you. And then look up for me and relax. And I do 1, 2, 3. It's going to help lighten her dark under her eyes. It will.
Burning, burning, burning. It'll go away in 15 seconds.
15 seconds. 15, 14, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Practically gone. Gone. Okay, now just close your eyes and relax. I take this finger and I hold it under her eyebrow and I go all the way to the eyelash line. I don't redip. You saw I didn't redip, right? Okay. And then I'm kind of going to massage it in so she's not as... I leave them kind of with it. If you're, now this is great for your male clientels as well. And if they want to shave the morning of the peel, that's good because this way you can get a little deeper. And then if they can shave the next day, it's okay. Or if they need to wait a few days before they feel comfortable, they can shave. So it's completely kind of up to their comfort level. But I do like them to come clean shaven if they can. And you can do up to 2 peels in one sitting. So oftentimes you do a lady's face and neck, and then décolleté needs help too. So I always say, you know, I'm going to make this all look beautiful and even skin. Why don't you also consider your chest? And then you upsell them and you do a peel for this area and a peel for that area, and they go home with 2 take-homes. Okay? All right. How you doing there, Lauren?
No, fine.
Okay, good. So you just keep doing passes until it's all gone. You kind of focus on the areas of her face that might need a little more attention, even though we do have a candidate with very beautiful, healthy skin.
It's going to get more beautiful after
Exactly. We're going to keep it this way.
Will this help with the acne?
Oh yeah, active acne, it dissipates. Occasionally you might see frosting, and when you see the frosting, it's the denaturization of the protein to the skin, to the acid. So it means that it's really penetrated and she's gonna peel in those areas. So when you see the frosting, I wait for it to subside. It might take 2 to 3 passes. After it subsides, I then will go over that area, but not as aggressively. The little lighter pressure. So when you see a frosted area, it's not like stop, never go back to that area, but wait till the frosting goes away, which usually takes 2 to 3 passes.
See any frosting now?
No frosting. It looks like white wedding cake,
I see.
like frosting, like white frosting.
I remember the blue peel. It was
Yeah.
a lot of frosting.
Okay, that was TCA up to usually
30%.
30. Yeah, sometimes people did the TCA. I think the blue pill with 25. Fine now, right, Lauren? You don't feel anything.
It's great.
She just looks like. I'm gonna hit. See that right there? I'm gonna hit that spot, and then you're gonna do it.
Okay.
There's a lot left.
All right.
Probably we could